The following is a presentation that discusses attention deficit hyperactivity disorder known as ADHD and Ritalin, which is a prescribed medication that's used to treat ADHD. ADHD is a very common disorder that can affect a person's ability to pay attention and concentrate. It can also play a role in how impulsive and how active a person is. Here are some behaviors or signs and symptoms of a person who has ADHD. So inattentive behaviors could refer to being easily distracted, forgetful, often struggles to stay focused on one task or activity at a time. They may have a hard time listening to when being spoken to, difficult time following instructions, or they may struggle with completing tasks. Hyperactive behaviors refers to difficult time sitting still and often feels the need to fidget and move around a lot. Someone who may be constantly in motion and on the go, and may also struggle with being able to play or do activities quietly. And lastly, impulsive behaviors may look like someone who struggles with taking turns, often interrupts others while talking, and often intrudes others while they are playing or completing an activity. But don't forget, you may have ADHD, but you also have many great things about you too. Okay, so a person has ADHD. Now what? What can be done? So medication is often an important part in helping people who have ADHD. It can be very helpful in treating inattention, hyperactivity, and impulsivity, and for improving those behaviors. Medication can help to improve relationships with friends and family, along with many other aspects of your life. There are many types of medication that can help in treating ADHD. However, we're going to have a look at something that's called Ritalin. Ritalin is only one form of medicine or treatment to help with the symptoms of ADHD. It may come in a pill or a capsule form in different doses depending on what your doctor will prescribe. Ritalin is a brand name medication, which its medical ingredients are from a type of stimulant drug referred to as methylphenidate. A stimulant is a type of drug that interacts with the brain and the body to provide more alertness, energy, and attention. Here you see is a list of other medical prescriptions which are similar to Ritalin in a sense that it comes from the same stimulant drug as methylphenidate. Just how does Ritalin work, you ask? Well, Ritalin, along with the other brand names previously listed, it is a prescribed medication that helps people diagnosed with ADHD control their behaviors in a more appropriate manner and to help them better be able to focus, limit the amount of distractions they have, and help to make better decisions. Ritalin increases a chemical in the brain, the part of the brain which controls things like attention, addictions, and decision making. This chemical is known as dopamine. When people have a lower amount of this chemical in the brain, this is when they become diagnosed with ADHD. Being prescribed Ritalin is one type of medication that can help your brain produce more of the chemical, which can help control the behaviors that someone tends to struggle with. A lot like any medicines, there is the potential for side effects to happen. So although Ritalin is prescribed to a person from a doctor and it's considered safe, there are some side effects that could possibly happen. The side effects may only last a short period of time while your brain and your body adjust to it, but in some cases it can last longer. Doctors, however, emphasize that the benefits Ritalin can have on a person are more likely to outweigh the potential negative side effects that someone may experience or feel. The following is just some of the side effects that Ritalin can include. You may feel nervous, you may feel insomnia, which is having a hard time sleeping or falling asleep. You may have a loss of appetite, abdominal pain, weight loss, rapid heartbeat, nausea, may have feelings of being dizzy or experiencing headaches. You may have changes in your blood pressure, and you may experience rash. So what exactly can happen if someone decides not to take Ritalin to help treat their ADHD? Well, if ADHD is left untreated or the medication prescribed to them is not taken, it can play a role in having further difficulties academically at school. It can interfere socially and emotionally, and it can also create more conflict at home. By not taking Ritalin or other prescribed medication for the treatment of ADHD, there are risk factors that it can have a negative impact in many parts of your life. If left untreated, it can flow through until adulthood, which then could affect your job performance, relationships, your mental health, your safety and well-being, and there's the possibility of turning to self-medicating, such as drugs and alcohol. Keep calm and don't worry. This does not mean that the medication is the only answer to get help with the treatment of ADHD. Ritalin is just one option of treatment, and there are many other medications that may work better, but that is up to a doctor to discuss those details and deciding what is best. Being that medication is not the only answer, there are options of therapy. There is a following link here for different other methods of treating ADHD. And however, it may be best if you have an adult or a doctor to review those options with you and to further explain what other treatments are available to treat ADHD.